So first I was going to talk a little bit about the differences between the ketogenic diet in children and the ketogenic diet in adults. And I think the big picture is that there is not very much difference, and that's been sort of my motivation for the work that I'm doing. I think an added challenge that I have in my field is that by the time patients come to my clinic and have never been on a diet, they've had an entire childhood experience of a certain diet by that time. It wasn't introduced when they were young, and so it is a big shift in their lifestyle. And that's also true for older adults who have really become kind of set in their ways, so to speak. And so I think there's that added challenge of compliance with adults because they have really already defined what their food preferences are and things of that nature. But other than that, I do not think that it is something that shouldn't be tried in adults. I think they should have all of the opportunities to be treated with ketogenic diets just like children. I use primarily the modified Atkins diet in adults that eat by mouth. The reason that I do that is I do find that it is easier for patients to comply with than the traditional ketogenic diet. There are absolutely exceptions to that. There are patients that want a more rigorous diet and want to weigh foods on gram scales, but the practical component of that is many of my patients are working, they have families, they're actually caring for other individuals, and to add a more rigorous diet to that is more challenging than the modified Atkins diet, where we limit the number of carbohydrates. They're able to count the carbohydrates, but they don't need to follow prescribed recipes and count the number of grams. So just in order to incorporate that into an already very busy day, they tend to find that easier to comply with. With regards to the risk of cardiovascular health in adults, that is something I'm very interested in pursuing. It's what keeps me up at night, wondering, are we doing the best thing for our patients? The whole concept of first do no harm is really foremost in my thoughts. We have done a preliminary study looking at 37 adults that were on the modified Atkins diet for a year or more, and we had baseline laboratory studies on them, fasting lipid profiles, and we looked at their baseline results and compared those to 3 months, 6 months, 1 year, 2 years on the modified Atkins diet. And what we found is that overall there was a significant increase in the LDL and the total cholesterol level at 3 and 6 months, but that increase actually corrected itself by 1 year and 2 years. Typically, if a patient starts a ketogenic diet or a modified Atkins diet as an adult, we treat it almost like a medication. If they remain seizure-free for 2 years on the diet, we will look at an EEG, and this is in situations where they do not have a known structural lesion or cause of their seizures that is likely to cause them to have continued seizures off of medication. If an EEG is normal, we would consider possibly tapering the diet. Usually by then, we have already begun tapering their medications and simplifying their regimen from that perspective as well. So it has turned out that the majority of our patients have decided to remain on the diet, and it's been a lifestyle change for them that they're happy to continue. So they just elect to remain on it, which is, we're happy to follow them after that as well.